Well, welcome to episode 3 of Triangle Dentistry Talk. I'm Dr. Bernstein from Bernstein Orthodontics, and I'm your host. Today, we're here with Dr. Brandon Coford from Cary Prosthodontics. How are you doing today?
I'm great. Thanks for having me here. This is fun to talk to you.
So today, we're just going to get a little knowledge about Dr. Coford's office, a little bit information about himself. But to get started, tell us a little bit about yourself.
Well, sure. So I'm Brandon Coford. I have been in the area here in Cary, and I live in Apex. I work in Cary. Been here since 2014. Before that, I was living in England, fulfilling a military obligation, paying back for the time that they taught me prosthodontics, and also for the time that they paid for my dental school. So I was trained in the Air Force in prosthodontics, and that was done in San Antonio, Texas from 2008 to 2011. And before that, I went to dental school in Cleveland, Ohio from 2004 to 2008. Before
Now,
that,
is that Case Western? Is that
that's
Cleveland
Case
and
Western.
Case Western?
Yeah,
Nice.
Case Western Reserve University. It was a great school. I always tell people that I'm a survivor because I survived Cleveland.
Yeah, I'm from Cincinnati, so we know a little bit about Cleveland as well.
Oh, totally. Yeah, you do. Let me just tell you that lake effect snow is a real thing.
Oh yeah, the snow in Cleveland is something else if you have not experienced, and the ice as well.
Yeah. Yeah, so it's funny, because I grew up in Utah, the Salt Lake area, and all growing up, snow, it would dump 12 inches of snow and we'd still have to go to school. Case Western, we'd get 12 inches of snow and you're still expected to show up for school. And then I moved to San Antonio, Texas and North Carolina, and if we get just like a little dusting of snow, it'll shut us down.
I mean, if we even get the word that snow or
Right.
rain in winter is on the way, it's normally a day off the next day.
Which I'm not
Even if it
complaining
doesn't
about.
snow.
I
No,
personally
not
love
at
it.
all. Yeah, not bad.
Yeah. So I grew up in the Salt Lake area of Utah, and I'm one of 5 children to my parents. And I'm the middle child, so that makes me the forgotten child. So if I seem a little loud at times, it's just because I feel forgotten and I just need to get some attention, right? And
Well, that's why we brought you on. We're giving you your attention now.
that's right. Yeah, thank you so much. And then my wife and we met on a blind date in 2003, and 2 months later, I was convinced, and I was able to convince her that marriage was a good idea. So I proposed on Christmas morning, December 2023, and we got married May 2000. I'm not 2023, 2003, and then we got married in May of 2004. And we moved across country to start dental school in Cleveland. I started dental school. She was supporting me through school. And so we knew that we wanted to have a big family, so we knew that we had to start young. And so it wasn't shortly after arriving in Cleveland, Ohio, that we started bearing children. And we have 6 children together, and their ages from 19 all the way down to 9 years old. So it's pretty much every 2 years, and Dr. Bernstein is kind enough to take care of their crooked teeth.
Yeah, they've been easy to work on. He's got wonderful kids.
Well,
that's wonderful.
We do like to brag about what a wonderful orthodontist we have.
I like to hear that as well. I won't. You can say that as much as you'd like. Just to kind of go. We learned a little bit about you, and I know there's obviously more, and you can always tell us some more here in the near term. But let's talk a little bit about your office. Cary Prosthodontics, and a lot of people. Kind of prosthodontics is also the lost child of dentistry to some people. They don't even know it's a field, but prosthodontics is obviously really important in our field and really beneficial to patients. So, tell us kind of a little bit about your office, what makes it, what makes an office a prosthodontic office, and, what makes your office so special.
Yeah, so I mean, it is true that a general dentist can do a lot of what a prosthodontist does, crowns, bridges, implant prosthetics. But the prosthodontist is the one who has specialized in that field of just replacing missing teeth and severely affected tooth structure, right? So we'll do anything from a full mouth rehabilitation because of wear, secondary to erosive problems like that follows bulimia or alcoholism or gastroesophageal reflux disease, or patients who just really grind their teeth down and wear them down and lose a lot of their chewing structures, and their facial aesthetics are affected by that, and they just need, in order to have their facial aesthetics restored, we need to restore all of their teeth with crowns. So it's more complex treatment that we specialize in. But we'll do anything, even down to a single unit crown or even just a little filling. We like to just restore missing tooth structure and missing teeth.
And
it is
definitely. Go ahead.
Oh, no, I was going to say it's 3 additional years of training beyond dental school. And so those are 3 very intense years. I remember coming home from work in residency one evening. It was 10 o'clock at night, and my wife was still up, and she looked up and she said, "You're home early." So it was not unusual for us to be working from 6 in the morning until like 2 o'clock, 3 o'clock in the morning, and then have to be back to work at 6 o'clock in the morning. We learn how to do our own laboratory work. So as prosthodontists, we really do know the laboratory processes, and that helps us communicate to the laboratory very efficiently, very effectively to get whatever it is that we're trying to achieve for the patients. And then when needed, we can jump in and do the laboratory work ourselves to make sure that it's done exactly to the patient's expectations. So there is a lot that goes into becoming a prosthodontist beyond just graduating from dental school.
And then that's the thing, Dr. Koford said, a dentist can do, a lot of what a prosthodontist does, but especially Dr. Koford, if you go see their office as well, they have all the new technology, they have everything that's going to help them get you a good outcome. But at the same time, and I think this probably goes with most prosthodontists, they are going to pay attention to the fine detail. And one little thing off probably would be great for your whole life, but they're going to make sure that it's perfect and they're going to make sure that it fits. And I think that's one unique thing that you get with a prosthodontist is the fine attention to detail, which we all want to give the best product to everyone, but just they can see things that sometimes the general dentist, as we didn't have additional schooling. I mean, I'm an orthodontist, so I don't even remember how to do most of this stuff anyways, but they're going to catch that fine detail. It's a little bit off and they're going to fix it for you and make sure that it's perfect. And I think that's, one of the specialties and one of the wonderful things that a prosthodontist is able to provide to those patients. Would you kind of agree with that a little bit?
Yeah, I do. And I mean, we're not just trained, but we have the experience to anticipate future needs that are going to arise. And so we just kind of think differently than we would had we just stuck with what we were trained with in dental school. So a lot of times, even just the treatment planning is a little more strategic than you might just going and doing kind of like your single tooth dentistry approach. So.
Yeah, and I think, when we look at a prosthodontist, what are, like if you were to pick a few categories or a few treatments that most people would say this is kind of what you get more frequently, would it be dentures, implants, full mouth rehabilitation? What age groups do you traditionally see? Obviously it can be any age, but what is it that you're kind of normally seeing?
Yeah, so I would say that among our younger patients, so a lot of the patients that you and I collaborate on are going to be because of congenitally missing teeth. And so that's going to be between ages, let's say 15 to 20. where you and I will collaborate by creating space for congenitally missing teeth. And then once they're done with braces, they come to me, and we don't do implants at that young of an age. So one of my preferred treatment options for a congenitally missing tooth in the aesthetic zone, in the smile zone, would be what we call a modified Maryland bridge, which is a zirconia veneer on the back of a tooth that is there that holds or suspends a dummy tooth that we call a pontic in the space where the missing tooth is. So we see a lot of that, congenitally missing teeth in the young adolescent to young adult. And then the next main age group that we'll see is probably between 30 to 50-year-olds. And that's where we're seeing more of the, the teeth are still serviceable, so let's go ahead and try to get as long a life out of those teeth as we can, so long as it's, reasonable. So that's where we're going to see more of our rehabilitation of the worn or diseased dentition that's still serviceable. But then, the next main age group is typically between 50 to 75 years old. I don't want to limit it to that because we'll see patients into their 90s and beyond, right? So, but they're 50 to 90-year-olds. This is where patients are typically in what we call the terminal dentition. There's no real justification for hanging on to teeth, whether it's because of decay or periodontal disease. And so they're facing this decision about whether they need to remove their teeth and just have a conventional denture, which is something that rests on gum tissue, or if they're going to transition into something that we call a full arch fixed type prosthesis, which is a bridge on between 4 to 6 implants. For listeners who are familiar with this term, it's like the all-on 4. So we provide that treatment in our office. Or there's something in between that's called an overdenture. So it still utilizes implants, but it's still a prosthesis that rests on the gum tissue. It will just snap onto those implants. So it's assisted, it's retained by a snap feature in the denture to those implants. So that's kind of the age ranges and the typical treatment evolution in those age groups. But we also have seen cases where, 35 years old and it just didn't make sense to keep the teeth because of, there's been drug abuse, history of drug abuse, or there have been attempts to save the dentition. But despite those best efforts, the patient still has excessive decay, and it just doesn't make sense to put more money into the teeth because the process that's destroying the teeth is going to continue, whereas that same process doesn't affect titanium. So it just makes sense to establish a foundation that is not subject to the same disease process.
A lot of people, there's always some people that say, I just want to have all my teeth taken out and get dentures because they want it perfectly straight. Obviously,
Right.
We don't want to do that to everyone. Dentures aren't, the end all be all. There's issues for that as well. But when you have a patient that comes in and they say, I just want to have all my teeth out, but some of their teeth can be saved, or maybe they can't be, what is it? And, how do you kind of get that patient, communicate with them and provide them with a treatment plan that would be best suited for them? So what is it that normal steps that when they see you into getting treatment, how does that normally go?
Yeah, and that's a very great question. And I'm so glad you asked that because a lot of patients, they just want to come in and they just want to know, okay, doc, what do I need to have done? And it's really not that easy, because we're talking about trying to build something that we want to last 20, 30 years or more. And so it's very much like construction work. I hate to bring in such a crass analogy, but It's a lot like construction work where we have to do a lot of due diligence before we can even make a reasonable recommendation for what good treatment would be. So a patient comes in and they want to just, I'm sick of my teeth, I'm done with them, just let them be gone. We always let the patients, take control of their treatment, the patient autonomy. We believe in that, but not without informed consent. So we do a consultation appointment, and we are very frank and honest and open with them about what that would look like to remove all of their teeth and what they'd be looking at for the rest of their life, and kind of how that would affect their experience with such basic things like tasting their food.
Mm-hmm.
Because when a denture covers the palate, it covers the taste buds that are in the palate. It covers the sensory, the temperature and texture sensory that you experience with food. So food is greatly affected. Your experience with food is greatly affected with dentures. So if teeth can be saved, and it's reasonable to have a really nice outcome that is going to improve quality of life while also maintaining some teeth, then we like to entertain that type of treatment outcome. And so it just takes a little bit of a workup. We need x-rays, we need impressions so that we can put them on a jaw simulator. We call it an articulator. And then we get to evaluate space considerations, we get to evaluate aesthetic considerations and functional considerations. And that's just not super easy to do right in the moment in the patient's mouth. With an articulator, I can like turn it around and look at everything from all views. So it is nice when patients come in with an understanding that, okay, doc, this is what I'm thinking, but I need your advice and your counsel. And so I understand that you might have to do a little bit of studying of my situation before we can really have a good, well thought out treatment plan. Love that. But we live in an Amazon age.
Yeah. Everyone wants things now, and they want it as soon as possible. But I think what Dr. Kofort was saying right there, and kind of tying into, what is the benefit of a prosthodontist? And I think that is one of the main things and one of the big things that you get with a prosthodontist, someone who specializes in that rehabilitation of the mouth, is they're able to show you visually, not just a computer diagram or a computer workup, but they can show you on a 3D model of essentially of your teeth. And if you wanted to make an adjustment, they know how to do it because they know how to do the lab work, and they can make it so you're happy with the result. And it's not just the dentist saying, this is what, we want to do this, and this is what it'll look like. You'll be able to see it even before and kind of be included in the workup, which is, I know that, most, and I would hope all prosthodontists, are doing that, but we have wonderful dentists. We're lucky to have wonderful dentists in a dental field in this area of Cary and Raleigh and the Triangle area. But I think that's one of the great specialties and the great things that prosthodontists do is able to really work up your case before it's even in your mouth, and you can kind of see an end result.
Yeah. So I saw a 21-year-old today in the practice for a consultation. And, he just wasn't happy with the way his teeth appear in his smile. And he was wanting to be consulted for veneers or possible bonding. And I told him, I said, that all that can be done, but you just need to know that no dentistry lasts forever. And so if you do that, you're kind of committing yourself to a lifetime of maintenance on the dental work on whatever teeth you affect. And then I told him, I said, honestly, as I look at it, I think that all you really need to do is it's a surgical procedure called aesthetic crown lengthening. You just need to do for you surgically what nature didn't do. Right? And so, Dr. Bernstein, after a patient's teeth erupt into their mouth, then there's a process called passive eruption, where the gingiva settles at the appropriate relationship to the crown of the tooth. Well, this guy's gingiva didn't settle there. And so he and the mom were so grateful that somebody finally explained to them why the teeth didn't appear like they wanted them to appear. And, you know, despite having seen several dental professionals, it wasn't until they came to my chair and I was able to help them understand that, you know, if we do something restorative, that's going to be altering those teeth forever, in a way that's going to need maintenance. Whereas if we just complete for you what nature didn't, then that's something that's going to immediately improve the aesthetics of your teeth. And then it's not man-made. Those teeth could last forever that way. So those are the types of things that we as prosthodontists always consider. Maintain something that could have been more easily resolved with something that didn't have to be maintained over the course of their lifetime. So you just don't ever want to go into dental treatment thinking of it as, you know, it's just a veneer or it's just a crown. Well, no, it's actually, teeth are really important, and we need to respect that and try to think about ways that we can keep them as functional and aesthetic as long as possible. And so there's an algorithm to, you know, the way to think about how to achieve patients' aesthetic expectations and their aesthetic desires. And, you know, ortho is actually one of the first and easiest ways to meet the aesthetic expectations just by getting teeth aligned properly. That has such a huge impact. So that would always be my first line of treatment. And then after that, if there's like some significant staining that you just can't fix with bleaching, that's the only time that I'd really recommend going on to some kind of restorative solution to mask that and improve the quality of life, with the understanding that this is something that's going to have to be maintained. So it's not just a one and done. Plan on having to replace this sometime, a couple times throughout your life.
Yeah, I think that's words of wisdom there from a specialist. You should all take that to heart there. You know, I think we've had a wonderful time getting to know Dr. Coford today and learning about Cary Prosthodontics. I think if you are in this area, which is, you know, Cary, but obviously if you're in the Triangle area or even if you're further away, I mean, it's definitely worthwhile to, if this is some sort of treatment that you're interested in, I think it's worthwhile to you to give Cary Prosthodontics a chance, give them time, listen to them, because I think what you'll get from them is, I mean, A+ work. You'll get, you'll meet all your expectations. And at the same time, if you do get work there, I think you'll be extremely happy and hopefully want to refer all your friends and family there as well. But any final words that you'd like to send us off with, Dr. Coford?
Well, yeah, I'd also just tell people that don't be afraid to look for a second opinion. And a second opinion doesn't mean that you are going to pursue treatment where you get the second opinion. So we're always happy to see patients and just offer them our recommendations, and they can take that back to whoever they were seeking treatment from to begin with. So use us as a resource for dental knowledge and dental treatment as you wish.
Well, it was a pleasure having you on today. We will hopefully have you on in a future podcast as well. But otherwise, have a great.
Great.
Yeah, definitely. Have a great day.
Hey, you too. Thanks, Carl.
All right. Bye-bye.